Hi, I'm Christy from Fitness, and I'm here with Dr. Hitty because Dr. Hitty is our leading referrer from Ashwaubenon. So Dr. Hitty, tell us, how do you determine when the right time is to speak with your patients about referring to the fitness center?
So at every single one of my well visits, I usually close by talking about routine wellness topics. So things like wearing a seatbelt, things like wearing sunscreen. And for every single adult patient, I remind them that the goal is to move their body exercise at least 150 minutes a week. And it's really often just as simple as that. If I sort of wonder or question if they're actually doing any exercise or it's come up on their social determinants of health form, a lot of times the next question I'll ask is there anything we can do to help with that? Or I'll simply say, what are you doing to achieve that? And that often is a really easy way to open the door to talking about exercise in general.
And then when you do determine it's the right time, how do you frame the discussion to make it appealing for them?
So for most of my patients, they have reasons why maybe they're a little bit afraid to exercise or they just don't know what to do. So especially if we've talked about any acute injuries or pain, knee pain, hip pain, back pain, I'll remind them that we can refer them down to our gym. Either as a step down from physical therapy or for somebody who just isn't quite sure where to start. So I usually will tell them I can refer you down to our gym. The trainers can show you how everything works so you can learn. We have classes if that's something that works for you with a set day and time. And then I also remind them that the trainer can help them come up with a plan to create some exercises that are not going to hurt or not going to flare up their chronic issues.
Good, that sounds awesome. Do you typically receive positive response when you?
I do. Most of my patients are receptive to that. Not everybody accepts the referral. I certainly have some people who say, well, I'm already swimming at the Y or I'm already doing this. So it just opens that door to talking about exercise, which is fantastic. And for a lot of my patients, I remind them that that exercise number in a lot of regards is even more important than the number on the scale when we're talking about health and fitness. For some patients, they really find that a way to exercise and take away some of the fear.
Awesome. Good. And so what tips or suggestions would you have for any of your colleagues about referring to the fitness center?
So I put it as part of my routine counseling. Every wellness visit, kids and adults, we talk about a minimum exercise goal just as part of my routine counseling. I also have my staff set up to feel empowered to put in referrals on their own. So if they look at the social determinants of health, or if the patient mentions it, or if the patient asks, or on a phone call, my CTCs can put in a fitness center referral at any time, even without asking me.